Canada's most populous province has set a new record for the number of single-day coronavirus infections, reporting more than 4,400 cases and 15 deaths. Hospitals across the region are starting to cancel elective surgeries and non-urgent procedures to ensure they have the capacity to treat more patients. The new figures come just days after a stay-at-home order was imposed on the province in an attempt to curb rapidly rising infections. Joining us live for more on this from Victoria in Canada is April Lawrence, a reporter at CHEK News. April, take us through just how bad things are getting on the ground and how your health systems there are coping.
Yeah, there's no question, Ashley. We're in a third wave here in Canada, right across the country. Some provinces hit harder than others. We learned today that here in BC, we reached a new record number for ICU, that's intensive care admissions in our hospitals. And as you mentioned, we heard about 3 hospitals have had to cancel elective surgeries to move staff into those ICU wards. We also heard that variants now make up about half of all COVID cases in this province. So not a good picture. We also heard reports now that Canada has surpassed the United States as far as cases per million people. So not a great distinction there. And people are definitely listening. This is supposed to be worse than our first and second waves. And certainly we are seeing that with record new case numbers. Our vaccination program lagging a little behind, which is part of the problem as we try to combat those variants that seem to be on the rise here.
And for us watching on from Australia, the idea of a third wave is pretty terrifying. How did Canada get to that point? Was it public complacency to blame? What went wrong?
Well, yeah, so after the second wave, things started to relax a little. The case numbers started to go down, and while each province uses restrictions differently, restrictions pretty much right across the country eased up a little. People, perhaps, like you say, got a little complacent. And then when the variants started to arrive, obviously arriving from other countries, we weren't sure exactly what that was going to look like. I know here in BC, health officials, they were cautious, but they weren't raising alarm bells. We, instituted a few more restrictions, but not a lot. There's a lot of things we can still do here. We can gather with 10 people outdoors. You can hold small worship services outdoors. We can go to the shopping mall. We can go grocery stores. We can go to restaurants as long as it's on the patio. So they did take a few steps here to try to cope with this. Inside restaurants, not allowed, masks now required in schools for kids grades 4 and up, but our schools are open. In some other provinces, we heard today in Ontario, that's facing a surge similar to here, they are not going to return to in-person school learning after their spring break. They're closing schools. In Quebec, they've instituted curfews. So it's a really broad range of restrictions that they're instituting right across the country. But, is it too little, too late? That's a question a lot of people are asking.
And so how's the vaccine rollout tracking there?
Well, we've faced problems ever since the beginning with supply. Canada doesn't have its own domestic supply of vaccine, and that was a decision made many governments ago. But it's the reality of what we have to deal with. So we right now have 3 vaccines that we're using in the country. We have the Pfizer, Moderna, and AstraZeneca. But we're at the mercy of when those shipments arrive. Pfizer has been fairly reliable, we've heard from our health officials, sort of trickling in 1 shipment a week. Moderna has not. We are never sure when to expect that vaccine. And as far as the AstraZeneca, we were hopeful that would be able to be delivered to our frontline workers. Mostly in Canada, the vaccine program has rolled out based on age, vaccinating those who are elderly first. But we were going to use the AstraZeneca for those frontline workers, school workers, police officers. But unfortunately, due to concerns about the potential link to blood clots, it's now only being used for people between 55 and 65 here in BC, and those who want to still have that vaccine. So we heard from our officials here today that we have the capacity to rapidly ramp up our vaccination, but we're just dependent on supply. I think at last check, about 20% of the eligible Canadians have received 1 shot, 24% here in BC. So getting there, but certainly not fast enough, and not fast enough for our health officials either.
April Lawrence, we all hope the situation there in Canada does improve sooner rather than later, and we feel for you all going through that third wave. Thank you for joining us. Appreciate your time.
Thanks, Ashley.